Hello, my name is Esther Hyun, and today I will be discussing the use of Leqembi as a clinical intervention for Alzheimer's disease. As of July 6th, 2023, Leqembi is the first traditionally FDA-approved amyloid beta-directed IgG1 monoclonal antibody treatment for Alzheimer's. Alzheimer's is a topic that is very near and dear to my heart, and I'm excited to see this advancement in clinical research. To preface, Alzheimer's disease is characterized by various molecular and cellular changes, including the buildup of amyloid plaque, the presence of neurofibrillary tau tangles, chronic inflammation, vascular factors, and loss of neuronal connections with eventual cell death. The purpose of this video project will focus on how Leqembi specifically targets the buildup of amyloid plaque. It's also important to consider that Leqembi does not cure Alzheimer's disease or cure related cognitive deficits. Rather, it is the first drug to show clinical benefit in terms of slowing earlier progression of Alzheimer's disease or those with mild cognitive deficits. Below is a picture that shows the significant difference of the amyloid plaque when comparing a normal patient and a patient with Alzheimer's disease. Amyloid PET imaging uses FFDG and F-fluorobutapir to essentially light up amyloid plaque areas. Before I discuss the purpose and significance of Leqembi, I'd like to explain what amyloid plaque is. Amyloid plaque is made up of strings of protein called beta amyloid that clump together. Beta amyloid can exist as various species, but oligomers and protofibrils have been shown to be the most toxic, and removal of these aggregates may benefit overall presentation for patients with Alzheimer's. This beta amyloid comes from a larger protein called APP, or amyloid precursor protein, which is found in the fatty membrane surrounding nerve cells. APP is made of 771 amino acids and is cleaved by two enzymes to create beta amyloid pieces that are made up of 38, 40, or 42 amino acids. The structure of beta amyloid does depend on how many amino acids it contains. For example, beta amyloid 42, which is made up of 42 amino acids, is quite toxic and much more common in Alzheimer's disease compared to other types of dementia, such as vascular or frontotemporal. The presence of plaque can impair cell function and eventually cause cell death. And some hypothesize that beta amyloid can also influence the release of free radicals that attack neurons. So, what is Leqembi? Leqembi is an antibody treatment that is designed to bind to and neutralize a soluble, toxic version of beta amyloid, specifically these protofibrils. Essentially, we are tagging these beta amyloid proteins in order for the body's immune system to clear these before they can reach toxic levels, and we want to prevent this clumping or aggregation. A typical dosage is a solution that's diluted to 10 milligrams per kilograms, and this is administered through IV for 1 hour once every 2 weeks. Interestingly, it appears that the newest data shows that subcutaneous injections are more effective than IV in terms of reducing the amount of beta amyloid, and there was also a reduced frequency of any adverse reactions for subcutaneous versus IV. Given that this is a new drug, I think it's also important to discuss the contraindications. About 2 of 10 people who receive Leqembi can develop something called ARIA, which is amyloid-related imaging abnormalities, which can cause cerebral hemorrhaging and/or edema. Therefore, patients who are interested or are candidates for Leqembi treatment should undergo genetic testing for APOE or apolipoprotein E, specifically E4, prior to initiation of treatment to reduce the risk of any adverse side effects. Also, it's important to consider that one should be more cautious when considering Leqembi for patients who are participating in anticoagulation therapy because it does increase the risk of brain bleeding. This isn't to say that patients who are receiving this therapy are automatically excluded from being candidates for Leqembi, but it is important to discuss with your provider. Overall, I'm very much looking forward to how this drug impacts those now that it is FDA approved, and I will be looking forward to further research.